this message is just for you. Are you already in nursing school? Are you thinking about becoming a nurse? Maybe you're a CNA or maybe a lab technician, or maybe you're a new nurse and you're within the 1 to 3 years. Well, this is just for you. So today I want to talk about the weight of nursing school because it's a lot. And a lot of you may say, well, I hear that all the time, but what do you mean? It is a lot. And it is a lot emotionally, physically. It is a lot on your body. It is a lot on your mindset. It's a lot with your personal life, as well as the requirements for nursing school. And we know that nursing school, just like any other specialty that has a medical license where you're caring for, patients or residents, that, you have to be on point, crossing your T's, dotting your I's, because their life is ultimately in your hands, especially as a CNA and a nurse. A CNA because in the residential area where they are residents in that long-term care setting, that nursing assistant is with the resident 24/7, providing that entire holistic or mind, body, soul, providing that care for that member. And then the nurse will come in as they need to do their assessments throughout the day, pass their medications, and just to, take a look to see how the resident is going throughout the care plan. So everything depends on you. When you begin to get into, a nursing school, you begin to hear conversations that this is a lot. And for some strange reason, it's like a magnet. Nursing school is like a magnet. Everything that could possibly go wrong in nursing school, it happens, which is so weird. Meaning you have your personal life and your nursing school life, everything blends together, it meshes. So my particular story, very briefly, with the weight of nursing, because it is a lot, and literally I mean blood, sweat, and tears. I say that because the unexpected happens, and sometimes there's just no way to work around that, and you just have to act in the moment. And nursing school is very strict, strict criteria, how many days you can miss. Everything is not even really all about the university. It's about what the state requires that you have to have. So it's nothing that sometimes the professors are making up or the university. They have to adopt governing rules, federal rules and state rules. They have to adopt across the board, which is mandatory. And so you will have family members that will have just passed away, whether it is immediate, and I wish that on nobody, whether it's immediate, grandparents, aunts, uncles, or whoever that main person is in your life, could be best friends. It's just the timing and the season. It's just like there's never a perfect time to start nursing school. The time is right now because life is going to keep lifing. And the best thing we can do is try to maneuver and navigate our way through that journey. It's very important that you have some type of support. If you don't have an aunt or an uncle or a close friend, you need somebody in nursing school to have that support. Some people will be pregnant in nursing school. Some people will be high risk in nursing school. It just happens. But the one thing I want to tell you is to hang on in there. As long as you're being upfront and do things ahead of time, don't wait to the date of, to say, hey, I have this going on tomorrow, or I'll need to have time off next week. Be upfront with everything. If you know that you have a procedure coming up, or if you know this is going to happen, say it right then and there. I don't care if it's 3 o'clock in the morning, because you will learn in nursing school and for the rest of your career, professional career, that those timestamps, those dates are everything, and you keep everything in writing. So, for example, when I was coming in school, I was a double major, and I was not trying to be a double major, but I ended up being a double major because nursing school is very strict. And if something goes off, depending on what college you're in, you could be put on probation. Sometimes if you're put on probation, meaning you will not be allowed to take certain classes, they will not unlock, because some courses are locked for a certain level of students, or after you've acquired so many hours of a certain course, and then you have to have made a certain grade. The grading scale is much higher and harder in fields that require a license to take care of patients. So for example, you may have 90 to 100 is considered considered an A, but in nursing school, usually that GPA is much strict. So if you have a 90, that's considered as a B in nursing school. And there's usually no rounding. So I remember one time I had a 76.6. I was called in my director's office. She was disappointed in me because I had a 76.6. And that's another story for another day that we will get into. But there's no rounding. So that was a C. And if I did not bring it up, I would have to take that entire course over again. And I believe you only get 2 takeovers for most college institutions. Is my phone charging? I don't know if my phone's charging. I got everything hooked up. Okay. So anyway, but it's much harder, the grading scale in nursing school. So I started out at one college and then I ended up transferring to another college is what I did. And the first college was a public college. The second college was a private college. So started off in nursing school and they had upper division and they had a lower division. But the upper division, you had to have like because it was limited sizing, I had to have a 3.4 GPA, and I didn't have a 3.4 GPA. I'm like, how will I do this? And they're like, well, there's a wait list because it's just limited spacing. I'm like, I don't have time to do this, to be stuck at this under division for so long. So I ended up having to take other courses to help bring up my GPA. But by that time, I'm on to the second baby, and it's just like, what am I going to do? So what I did was I took classes that was closely aligned to nursing or that were nursing prerequisites. So I have my first degree in psychology and then in natural science, concentration natural science. And then, so I took a lot of biology courses is what that is. So sometimes it can include physics, it can include biology, it can include natural science, and then of course your human anatomy and physiology. Depending on what type of natural science degree you get. Usually it's the world and everything around you to make everything make sense at the cellular level. So I was able to do psychology, and my concentrated courses, a lot of them were prereqs for the nursing program. And so I was still able to stay on track. And once I got as far as I could go, graduated with psychology, and then I transferred to a private college. I ended up writing them a letter, even though I didn't have to have a letter, but sometimes they're strict with your GPA and getting in school. I think I can't remember what grade point average that I had at the time, but I know it wasn't what most colleges say, okay, let's let her in right away. So I did write an appeal letter, and I did get in unconditionally, meaning that I was not on probation or anything like that. I was able to get into the nursing program and to finish up there. So I was able to graduate much quicker with my 4-year nursing degree because I did that route. But anyway, a lot of things will happen in nursing school, and the weight is very, very heavy. So what I want to share with you is that I was able to create a book. And it's really more like a companion and a journal. You'll learn in nursing school that you have reflection type courses. So at the end of your clinical rotation for that week, you'll reflect back over your laboratory time, your clinical time, just your entire experience. You'll reflect back, and your professor will have, or assistant professor will have, certain prompting for you to fill out that you'll learn from. And essentially it tracks all the way until you graduate. You'll have these reflective type assignments. And so, but it does not really address, I feel like, the emotional weight and the capacity that we carry internally and externally. And so, because I'll make a 2-part to this because I have to cut to another meeting in just a moment. And I'll make a part 2 to this video and pick y'all back up. But I created a companion that addresses the internal and external weight that you will carry, and it is developed off a formula that I created. I used like a real nursing curriculum. So as you start nursing school, it's more like an arc, I want to say, but you'll start out with like the basics, foundational type of information, starting with like your uniforms, expectations, and then and you'll start with the basic, almost like your anatomy type, and then it builds. You'll begin to start medical math, and you'll begin to hit a level to where you're doing like senior level nursing work, and then you'll come down because you're ready to get to that next that next level. Like you take the exams and then you go into the next course. So it is created off of a type of arc based on the emotions that you have from when you first start all the way to the type of peak of courses that you'll have, the level of complexity. And then it is also shaped on, for example, the emotions that's paired with that. I think I just said that. It's paired with the emotions of the weight that you carry, how to reach out to people or someone if you're having trouble, and meaning someone, meaning like, do I go to my professor if I have a concern? Do I go to the nursing director if I have concerns? How do you navigate that? How do you go through your nursing journey to say, hey, today I just can't, but this book is here to say, hey, yes, you can. It's based off real clinical experience. So the book, The Clinical Companion, like a journal, it is not filled with clinical work or assignments. Just for clarification, the formula that it is built on mimics like a clinical schedule and the emotions that usually occur around that time when you're entering nursing school. So if you're a brand new nurse or you're a nursing student, let's say nursing students, you're a nursing student and you're like, okay, I don't know what to expect. I'm so nervous. I'm anxious. There's the unknown that's there. So it's built around what do you feel as your first few weeks or maybe your first semester in nursing school. Based on my clinical observations as a clinical instructor or educator, based on my steps that I navigated through, and also personal experiences that other people have shared with me, like good friends, very good friends that are nurses today. So, you know, it's usually we all share similar emotions in nursing school. How do I navigate all of the experiences and the weight? It's just a lot of weight. But nursing school does not, I hate to say it, they really don't care about your personal weight. Even though, and yes, I'm saying that as an educator, but because there's so many strict requirements by the state and federal government about how many hours you have to have, or the way we're supposed to do things based on evidence-based practice, you know, there's really no bending the rules. It is what it is in nursing school. And that's why I say you're crossing your T's, you're dotting your I's, and you're underscoring, you know, everything. But there's a way to navigate that. There's a way to get through nursing school, you know, because you have to get it out. You have to get it out or you'll make yourself sick. You'll make yourself sick. There's fainting. There's, you know, if you already have, you know, systemic or autoimmune type, you know, concerns, it will trigger, it will inflame everything up nursing school because of the weight of it, the demands, the expectations that we have to do. Because remember, you know, we're there to save lives. Somebody's life is in your hand. That's no easy task when you really think about the magnitude of it, somebody's life being in your hands. And the nurse, we are at the bedside more than any other specialty. The nurse aide and the nurse is there 24/7, just about. You may have a few other specialists to come in, like maybe a respiratory therapist. Maybe it's time for a breathing treatment. You may have physical therapy to come in. You may have the doctor to come in very briefly to check where you've already checked, doing an assessment, or based on the report that the nurses is giving him, he will come in and he will verify, lay eyes on you as well, and just to verify the nursing care plan and follow up with his medical care plan. But that's maybe, like I said, the 4%, 6%, depending on the specialty, but usually the nurses are the ones that are there. So you have a huge, there's a huge expectation with us. And there's a lot of weight with that. And it starts usually in nursing school. And really, I want to say, as a certified nurse aide or a CNA, it normally starts there because, again, you're providing that full long-term care. But yeah, so just want to share with you that. And it is called The Nurse I Am Becoming. And I will put that link in the bio. So if you're interested in saying, hey, you find yourself, maybe you're nursing school, you're like, I've got this. But then there's like, man, I need something to get the emotion out. I need something. Is there something out there where someone understands me? And I'm telling you that, you know, I'm here not to look down, to look back. I'm here to reach back, grab your hand and pull you beside me. And, you know, if I have not been in that space, but I know how to navigate that space, to push you forward. That is my goal, is to say, hey, what could I could have done differently, or what is working for me, and I know you can do it better. So again, I'm reaching beside me, pushing you forward, or reaching back and propelling you forward for your nursing career, as a nursing student, as a new nurse, and a nurse leader. If you're having a tough time saying, you know, how do I prepare? How do I plan? This helps support that capacity. And so it is available at all bookstores internationally or globally. And then if it's not in your college bookstore, they can order it for you. It's also available on Amazon, and you can get it through Amazon. But again, it's a guide or a companion to help you navigate the journey of nursing school. And it's not just designed for new nursing students, but let's say like you're a seasoned nurse and you're taking that next level for, you know, getting your nurse practitioner. Everyone has a start somewhere, and the same emotions may not be as bad as it was in nursing school, with the emotions and the anxiety and, well, how do I go through these situations and challenging moments. But, you know, you'll go through something different at another level. You'll have the emotions like, man, you know, I'm at another level, but I'm still dedicated, and I feel like you may have anxiety, you may not have anxiety, but it's to help support you. It's supposed to help enhance your clinical judgment, your decision making. And again, it is The Nurse I Am Becoming by Dr. Nancy Farrell Jones. That is my first name. But friends and family in the virtual space, some people call me Shawnee. So, or some may call me Dr. Shawnee or Dr. Jones. And, but this is part one of what I want to share with you, that you can make it with support and the right tools. And so if you would love to hear more personal stories, hit that like and subscribe button, and I will share more personal stories with you. And the goal is not to be an expert in these areas. It's just to say, if I can tell my younger self something, what would it be? Now, I'm on my cell phone, so I'm trying to remember to look here, but I'm looking here. But this is for my younger self to say, hey, if there was a better way, or I've learned this through the experience by getting support, and this is what they've recommended, and maybe I've tried that, maybe I haven't tried it, but I've tried it and it worked. By the way, that little green little thing, one of my sons loves Legos. This is their Lego set. This is not my Lego set, and I need to find a space for them because they do not belong in my office. But there you have it. So until next time, we will talk soon. Again, my name is Shawnee. Thank you for joining me. Stay tuned for part two so I can really unravel, unfold my nursing journey. So that way, hopefully, you will be able to get some helpful insights on my journey and what I could have did differently.